and welcome. My name is Dr. Calliope, and I'm going to be taking care of you today, alright? Okay, how are you feeling today? Okay, well, I hope you feel even just a little bit better by the time you walk out of the office, okay? Alright, so I'm going to ask you some questions, and then we'll get started on our examination. Excellent. So let's see here. Would you mind just confirming your name and date of birth for me? Excellent. And it looks like today we have you in for a comprehensive physical examination. Is that correct? Is there any particular reason why you wanted to have this examination today? Okay. Excellent. I'm going to ask you a few medical history questions if you don't mind. Okay. Are you in any current pain or have any current illness? Excellent. And any changes to the medical history that we have on file? Wonderful. And what about your family history? And what about allergies? Any changes to those at all? Very good. And is your medication list up to date? No changes there? Okay. Wonderful. Excellent. So for our comprehensive physical examination today, we're going to comprehensively, of course, look over your whole body. So this will include looking at your head, your hands, your legs and feet, taking a listen to your lungs, your heart, and your abdomen. We're going to do some range of motion and strength exercises. Okay, just a hodgepodge of all sorts of things. So, I do have to apologize a little bit. It almost sounds like a touch of a windstorm out there, huh? Yeah. Office is a little echoey as we are moving currently, so there's a little bit of an echo. I do apologize for that. So, if you're all ready to begin, then we can go ahead and start on the examination. Okay, do you have any questions for me at all? Wonderful. So for this examination, I'm not going to use any gloves. However, certain parts I will need to touch you. Is that okay with you? Do I have your consent to do that? Wonderful. Excellent. Okay. At any point you feel any pain or discomfort, please let me know, alright? Excellent. I'm going to ask you just a couple questions for a very short neurological examination. What is the current date today? Okay. Great. And where are we? Where is our location at? Okay, the clinic, very good. And what's the approximate time that it is? Even just your appointment time works. Wonderful. Okay, I'm going to set this down real quick, and then I am going to start with a little look at your hands, right? Okay. So firstly, I just want to have you just put your hands out for me, if you will. I want to just do a little bit of an inspection, okay? I'm just going to hold on to your hand and just going to take a look at the skin of the hand, noting any abnormalities. I'm just going to palpate a little bit as well. Okay, I'm going to turn this hand over. Just take a little look. Okay. Is there any pain or tenderness while I'm touching your hand? Okay, we're doing all right. Great. So I'm just going to do the same on your other hand here. Just want to just have a little look. Okay. I'm going to flip the hand over. Any pain or tenderness upon palpation with this hand? Okay, very good. Alright, so I'm going to take both of your hands here and I'm just going to press on the nails a little firmly and then just release. Check the capillary refill in your hands, okay? Each of the nails, I'm just going to press and release. Good. Press, release, press, release, press, release, press, and release. Excellent. Okay, so general inspection and palpation look great. So now I'm going to do a few different exercises with you, okay? So if you could just follow my directions, that would be perfect, okay? Would you mind just squeezing your fists for me? Make a fist, okay? And then can you go ahead and just squeeze my hand here? Okay, that hand and then the other. Very good, okay. Can you flare your fingers out? Splay them out. Very good. And can you pull them back together? Very good. Now, I'm going to have you do a few exercises with your wrists, okay? So I want you to turn your wrists up, okay? And how about down? All right, how about out to the side, and out to the other side? Okay, very good. Now I'm going to have you pull your arms up, okay, like this, right? I'm going to try to pull, and I want you to resist me, okay? Very good. Now I'm going to try to push. I want you to resist me. Very good. Okay. Can you go ahead and just lay your arms out? Okay. All right. And go ahead and relax your arms, right? That's very good. So now we're going to move on to your head, your face, okay? I just want to just inspect you a little bit, okay? I'm just going to take a little look at you. Alright. Just making sure everything looks symmetrical. There's no overt visual abnormalities that I can note right off the bat. Okay? Alright, that looks good. So now I'm going to have a little feel along your head and your scalp. Just going to be kind of palpating around, seeing if there's anything out of the ordinary, right? Okay. If there's any pain or discomfort, please let me know. But I'm just going to come up here and I'm just going to feel around here. Okay, let me just look along the hairline. Take a little feel. Okay. Any pain or discomfort at all? Okay. Alright, that's what we like to hear. Okay, wonderful. So I'm just going to feel the back of your neck here. Alright, nothing going on. Okay. That all looks good. Right. Okay. I'm going to take a little feel at your lymph nodes on your head, around your neck, and around your clavicular area, okay? So it might feel touched like a massage. I'm just going to be very gently rolling my fingers over each of the lymph nodes. So we're going to start here at the back of the head with the occipital lymph nodes here. I'm just going to just work around. Okay, so now we're going to be feeling the post-auricular lymph nodes here behind the ears. And we're going to move on to the pre-auricular here, right in front of the ears. Go into something for your Sunday. Okay, now I'm just going to be feeling your tonsillar lymph nodes here. Okay. Alright, now we're going to be going into the submandibular and submental. Very good. Okay, let's see. Got the posterior cervical chain here and the anterior cervical chain. Excellent. And along the supraclavicular, right there. Wonderful. Okay, nothing of note. Wonderful. So now I would like to feel your thyroid gland, okay? So it might be just a touch uncomfortable, alright? Be feeling around, and then I'm going to have you swallow when I prompt you, okay? So I'm just going to feel right here, right there, okay? And if you could just swallow for me. Very good. Okay, that looks great. Okay, I'm going to take a little feel around your temporomandibular joint here, okay? I'm just going to be putting my fingers here and I'm going to be palpating around. Okay, would you mind clenching your jaw for me? Real tight. Great, okay. And can you open your jaw? Excellent, excellent, excellent. Okay, so now I'm just going to have a feel at your temples here. Okay, it all feels great. Wonderful. So now we're going to be doing a facial sensation test. However, I just need to grab two tiny but very important tools for that. I'll be but just a second, okay? Alright, so I fetched a cotton bud and a toothpick, okay? So I'm just going to very gently let you feel this right on the side of your neck so you know what the sensation is like. We're going to start with our dull sensation, okay? So just right there. Feel that? Okay? And then we have our sharp sensation. Not sharp enough to really hurt, not nearly sharp enough to break the skin, but you'll just feel just a touch, okay? Right there. Very good. So I'm going to be testing your trigeminal nerve in this. There are 3 branches to the trigeminal nerve. Control the sensation of the ophthalmic branch, the maxillary branch, and the mandibular branch. So I'm just going to be testing these areas. Make sure everything's working okay. So I want you to go ahead and close your eyes for me. Close your eyes, okay? And then when you feel a sensation, just want you to tell me either sharp or dull, okay? Just sharp or dull. Right, ready? Okay. Sharp can go ahead and open your eyes. That was wonderful. So now I would like to just palpate your frontal and maxillary sinuses, okay? Please let me know if there is any pain or tenderness in this as I just very gently tap along. What voracious traffic we have. Luckily our new office is going to be on a little area that's way off the main track. Okay, just gonna palpate the maxillary sinuses here. Any pain or discomfort at all? Okay, that's wonderful. All right. I'm just gonna write a few notes and then I'm gonna have you do a few different commands for me, if you don't mind, okay? So, there we go. Would you mind raising your eyebrows for me? Okay, can you close your eyes real tight for me? Excellent. Can you puff out your cheeks? Okay, very good. And can you smile real wide for me? Excellent. And can you stick out your tongue? Okay, you can put your tongue back in your mouth, although we'll be pulling that puppy out real quick in a second. There we go. Alright, so we're going to do just a touch of range of movement with your tongue. So, if you wouldn't mind just sticking your tongue back out for me. Okay, can you move your tongue upwards? And what about downwards? And to this side. And to this side. Very good. Now, would you mind if I just take a little peek of my pen light inside your mouth? Okay? Just open real wide for me. And say ah for me. Excellent. Uvulus in the midline. And would you mind just lifting your tongue to the roof of your mouth? Okay, very good. Alright, you can go ahead and lay that back down. Close your mouth. I'm going to take a look inside your nose if you don't mind. Okay, just tip your head back for me, and I won't get real up in your business, but I'll get a titch close, okay? Alright, just want to make sure that the septum is in the midline and that there isn't any abnormalities. Okay, looks like we are all good. You can go ahead and just put your face back down. So, have you noticed any changes to any of your senses at all? Sense of taste, sense of smell, eyesight, hearing? Okay, very good. So, I'm just going to take a couple notes and then we're going to work on your very grand eye test. Very grand in that it's one of the more extensive things that we test. Very good. So firstly, we're going to bring out the pen light here, okay? I just want to have a quick peek. Just want to have a quick peek at your eyes as a whole, okay? I'm just going to just look over and make sure the eyebrows are nice and full, the eyelashes are nice and full, the skin around the eyes is normal and pink and doesn't have any abnormalities. Okay, so I'm going to check your conjunctiva, okay? And I'm just going to be firstly pulling your eyelids down. I want you to look up, okay? Pull your eyelids down and look up for me. Good, okay? Now I'm going to pull them up and I want you to look down. Very good, okay? You're all good. So we're going to do some pupillary response tests now. And I'm going to take our pen light here. Okay. And I'm just going to be firstly checking your direct consensual response, right? So I'll put up a hand in front of us and I'll just bring my pen light in first this side and then the other. And we're going to test how your eyes react to the light. For example, when I bring in the light and shine it directly into this eye, that eye should react to the light. But then when I do the same thing, the light shining in this eye, your other eye should react consensually in the same manner. They work together that way, okay? So, I don't need any part on by you, I'll just look into your eyes, okay? Shine the light, note the direct response, consensual, any consensual response. Excellent. Consensual response is excellent. Now, I want to do a small test called the swinging light test, and I'll just be simply swinging my light back and forth between each eye, okay? Just go ahead and look straight ahead. You can look at me, look just past me, whatever way works for you. Okay? So I'm just going to bring the light and just swing it back and forth and back and forth. Okay, wonderful. So now we're going to do a little test that measures your ocular movements, your eye movements. So I'm going to have you track my fingers with your eyes. I'll just be moving these around and using only your eyes without moving your head. I want you to just follow my fingers. I'm going to step back to make it easier to move around for me, okay? But I just want you to follow my fingers using only your eyes without moving your head, okay? Very good. Step back. Right, ready? I want you to watch my fingers, follow my fingers, using only your eyes without moving your head. Very good. Excellent. Okay, no delay, no nystagmus. Okay, let's go ahead and try up and down and to the side, okay? Up and down and to the side and the other side, okay? And now we're going to do diagonally up. Good. Diagonally down. Excellent. Diagonally down. Diagonally up. Very good. Diagonally up. Diagonally down. Diagonally down. And diagonally up. Awesome. Very good. Now, I want to check your accommodation reflex real quick. So I'm just going to have my pen light on. I want you to follow the light, and I'll go in and out. Okay? I want you to just keep following this light as best as you can. Right? So we'll start here. Move in and out. And in and out. And in and out. Good. Okay. Let's go ahead and do that with the other side here. Going in and out. And in and out. And in and out. Yeah. Wonderful. Right? Let's see here. So all we've got left for our eye test is the Snellen chart, the visual fields test, and our fundoscopy, right? So while we're just hanging here, let's go ahead and do the visual fields test. So to check your visual fields, I'm going to have you cover one of your eyes with your hand, and I'm going to cover the same side, okay? Alright, so right here. And I'm just going to be bringing my fingers in and wiggling them, okay? When you can see my fingers come into your vision, I want you to just say yes, or, you can just say yes, okay? Alright, so let me know. Good. My fingers come into your visual field. Good. 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 Excellent. Now let's go ahead and do that for the other side. So switch sides here. Okay, ready? Good. 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 Perfect. You did excellently. Let's go ahead and move on to the Snellen chart, okay? Our Snellen chart is the eye chart behind us here, with the added bonus of a small sticker. Wonderful. Now, let's see here. So, firstly, I'm just going to have you read the Snellen chart with both of your eyes open. I'll have you cover one eye, then the other, and we'll read through that chart, okay? Excellent. Let's go ahead and start right here. Just let me know what I'm pointing at. Good. 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 We'll skip again. Good. 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 Skip again. Good. 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 Yes. Yes. Right? Let's go ahead and you read this line for me. Good. Yes. Yes. Good. Excellent. Okay. Do you mind covering one of your eyes for me? Right? Let's do that again. Yes. Yes. Good. Good. Skip. Good. Good. Mm-hmm. Yes. Mm-hmm. Good. 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 Mm-hmm. Very good. Very good. Okay. Mm-hmm. Mm-hmm. Good. Good. Mm-hmm. Yes. Yeah. Good. And last one here. Mm-hmm. Good. 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 Mm-hmm. Very good. Let's go ahead and cover the other eye. Right? Let's run through this one last time. Good. Good. Mm-hmm. Good. 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 Mm-hmm. Yes. Yes. Good. 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 Mm-hmm. Mm-hmm. Right, let's skip to here. Good. 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 Mm-hmm. Okay, let's skip once more. Mm-hmm. Mm-hmm. Good. 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 And just for funsies, if you would like, you can uncover both of your eyes and we can see if you can read the very last line. Okay? Try your best. Mm-hmm. 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 Good. Good. Mm-hmm. Perfect. All right. Well, your eyesight is definitely 20/20, both eyes. Now, you were able to guess some of the letters at the bottom there, but that's 20/10, which is better than most people. So 20/20 is definitely nothing to shake a stick at. All right. Now we are going to do a quick little fundoscopy, and then we are going to move on from the eyes, all right? So, to do our fundoscopy today, I'm going to need my ophthalmoscope attachment here. So, fundoscopy sounds a little complicated, a little complex, but I assure you it is not. Alright, I just need to, let's turn on there, and yeah. Okay, so all I'm going to have you do is look straight ahead, and I'm going to be just taking a look at the back of your eye with this little tool here. I'll be putting my hand on top of your head to steady myself. I'll be standing at an angle from you, and then I'll come in very close, okay? Okay, so go ahead and stare just straight ahead. I'm just going to put my hand on top of your head. And I'm just going to there we go. Adjust the ophthalmoscope, and then I'm just going to find the red light reflex. Here we are. Okay. I'm just going to come in very close. I'm just going to have a little peek around the eye. Just making sure the optic nerve looks good. All the blood vessels look good. No abnormalities. Okay. Go ahead and pull out here. And I'm going to do the same on your other side, okay? So I'm just going to put my hand on top of your head to steady myself. Put my eye in the ophthalmoscope, and then I'm just going to find the red light reflex good. All looks good. So I'm just going to go ahead and pop this out so that we can work on checking on your ears, alright? So firstly, I want to have a little peek at your ears. I want to take just a general inspection, do a touch of palpation, alright? Okay, so please let me know if there is any pain or tenderness at all, right? Okay, so I'm going to start with this ear real quick. And I'm just going to take a little look-see, look at the ear itself, see if there's any lesions or nodes or irritations. Okay, I'm just going to take a peek at behind the ear, the post-auricular area. Okay. Let's take a little look at the other side. Taking a look at the preauricular area, and in comes an airplane. Woo! Alright, let's take a look. Let's take a look behind the ear. Okay, very good. No lesions or nodes or any irritations. Okay. I'm going to just palpate the ears. Again, please let me know if there is any pain or discomfort or tenderness. Feel up the lobe, up along the lobe to the helix. Okay, to the tragus here. The bits, the inside, the inner workings here on the ear. Okay, and I'm just going to palpate the preauricular area right in front of the ears, and then let's go ahead and do the post-auricular area at the back of the ears. Just having a little feel here. Okay, wonderful. So now that that's all alright, I'm going to do just a quick little hearing test with you, okay? So I'm just going to rustle my fingers. Rustle. I'm going to rustle my fingers, and I just want you to let me know when you can hear it and when it stops, alright? Okay. I want you to close your eyes. Let me know when you hear it and when it stops. Good. Good. Excellent. Wonderful. Perfect. Okay. That was wonderful. So, let me take a little peek at the insides of your ear. So, just going to put on my otoscope attachment here. And let's get one of our sterilized speculums. Okay. Speculum at the ready. And there we are. Just pop that on. Pop on the light. Okay. And I'm just going to have a peek in your ears, okay? Please let me know if there's any pain or discomfort. I'm going to start on this ear here. And other side now, okay? So I'm just going to pull up and back on the ear and then inserting the otoscope into the ear canal. And again, just taking a look at if there's any irritation or swelling of the ear canal. If there's any redness, anything that shouldn't be there. And taking a look at the tympanic membrane, making sure that there isn't any perforations, that there's no injury, trauma. It's a nice pearly gray color. And you can see the cone of light at the tip of the malleus. Okay, I'm going to go ahead and pull out the otoscope. Okay. That all looked very good. Alright, so to finish off with your ears, we're going to do a couple of tests called the Weber and Rene test. Alright, let's see. I'm going to use a 128 hertz tuning fork for this. So for our first part of the test, I'm going to strike the tuning fork and I'm going to put it in the middle of your head. I just want you to tell me if you hear the sound louder on one side or the other, or if it is unilateral, right down the middle, okay? Right there. Hear that? Okay? Is it to one side, the other, or right down the middle? Good. Go ahead and do that again. There we go. Lord knows that hurts something fierce. Alright, still in the middle, not one side or the other. Very good. Now for our next part of the test, I'm going to strike the tuning fork and put it on the bone behind your ear. I want you to let me know when you hear it, when it stops, and then I'll bring that tuning fork right in front of your ear and just let me know if you hear it and when it stops. Okay? Ready? There we go. Hear that? Okay, once it stop? Okay, what about that? Hear that? Once it stop? Good. Alright. Hear that? Good. Once it stop? Okay. Hear that? And once it stop? Right about there. Excellent. So, I'm gonna have a nice little bruise there in the morning, aren't I? Tried to strike that tuning fork on my shoes, on my desk, just as a bit of a difficult time with me. Alright, I'm just going to note down what the results were for your ear tests here. And now I'm going to just test some range of movement with your head, okay? So firstly, I want you to turn your head to one side, okay, and then the other. Very good. Can you turn your head all the way down to your chest? Okay, and back. Very good. Can you tilt your head down to one shoulder? Okay, and the other. Very good. And let's see. Would you mind shrugging your shoulders for me? Very good. Can you keep them shrugged up? And I'm going to try to push them down. Don't let me. Okay, very good. Excellent. So, head's range of movement is excellent. So, now I'm going to be auscultating your lungs. Be taking a little listen to your lungs. Alright, So, when I ask you to, I'm going to have you take deep breaths for me, okay? Alright, so let's go ahead and place that right there. Take a deep breath in and out. 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 Okay, so now I'm going to be doing a test called vocal resonance. So when you feel the stethoscope touch your chest, I want you to say the word 99, okay? Just 99. Sounds like somebody's having their dog out for a walk. Hopefully they pass quickly, but in any case. So when you feel the stethoscope on your chest, I just want you to say 99, right? Okay. 99. 99. 99. 99. 99. Excellent. So I'm going to go ahead and percuss the lungs before we move on to the posterior chest wall. So I'm just going to be putting my hand on your chest in different places and just tapping on that, okay? I just listen for the sounds that come back. Right. Good. 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 Oop. There we go. Good. 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 Excellent. So now I'm going to be doing all of those steps, but on your back, okay? So I won't be in view for a little bit of time, but should be fairly short, okay? Alright, so I'm going to move to your back. Alright, so I'm just going to take my stethoscope and put that on real quick. My apologies, the old ball and chain wanted to know if I liked meatloaf. Which, I mean, I guess if he's serving it, sure. Alright, so I want you to just take a deep breath when I ask you to, alright? Okay, take a deep breath in and out. 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 Very good. So we're going to do our vocal resonance test again. So when you feel the stethoscope on your back, I want you to say the word 99, okay? Alright. 99. 99. 99. 99. 99. 99. 99. 99. Excellent. And lastly, I'm going to percuss your back. So, breathe normally for me. Okay. Good. 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 Very good. I'm gonna come back around. All right. Wonderful. Okay. I just want to real quick go ahead and check on your spine. So I'm just going to feel around your spine. I just want you to let me know if there is any pain or tenderness, okay? Just going to feel along the spine here. Any pain at all? Okay, any tenderness? Very good. Okay, excellent. So let's go ahead and take a little listen to your heart as well. So firstly, I want to just want to go ahead and lay you back, and we'll check on a couple of things before we listen to your heart, okay? I'm gonna have you lay back here, right? And firstly, I'm gonna check for jugular vein distension, JVD, okay? I just want you to go ahead and move your head to the side, alright? And I'm just going to watch your neck for a second here. Okay. Alright, no JVD there. So, do you have any pain in your neck at all? Okay. I'm going to go ahead and palpate the carotid artery on both sides of your neck, okay? So I apologize if this is a touch uncomfortable, okay? The other side there. Very good. Now, I'm going to have a listen to your carotid artery. Just going to be listening for any bruits. So, I'm going to have you take a deep breath in, okay? Deep breath out, and then hold it, okay? So hold your breath while I'm listening to your carotid artery. Just a little bit longer for me. Okay, very good. Go ahead and breathe normally again. So I'm just going to be feeling for your apex beat, okay? That's going to be on the mid-clavicular line around the 5th intercostal space. So I'm just going to be palpating around here. Okay, and then 5th intercostal space. Okay, right about there. Okay, very good. So I'm just going to go ahead and put my hand in different places on your chest here, and I'm going to be feeling for heaves and thrills. Just keep breathing normally. Good. Very good. So let's go ahead and take a little listen to your heart valves. So you can go ahead and breathe normally. Firstly, going to listen to your mitral valve here. Okay. Good. And the tricuspid. And the pulmonary. And the aortic. Okay, very good. Alright, that sounds good. So, I'm going to go ahead and take a few notes real quick, and then we will have a little listen to your abdomen. Very good. So I'm going to take a little listen, and then we will palpate your abdomen and percuss, okay? So I'm just going to stand to the side here and just take a little listen, alright? Just listening with my stethoscope. Good, okay. Alright, so firstly I'm going to palpate lightly, and then the pressure may be quite firm, okay? Alright, so I'm just going to palpate lightly on the abdomen. Any pain, tenderness? Okay, no sharp pain, nothing. Very good. Alright, now I'm going to be doing it a little deeper now, so it'll be quite a firm pressure. Very good. Okay, so now I'm going to percuss your abdomen, alright? Just the tapping like we've done a couple times previous. Good. Good. Very good. Very good. Okay, so we are getting somewhat close to the end, alright? So we're going to be taking a little look at your legs. We're going to be doing a lot of range of motion exercises. We'll check your reflexes, okay? So firstly, I'm just going to take a look at your legs here. Just going to look at the skin, making sure there's not any ulcers or any skin abnormalities at all. I'm going to be feeling your pedal pulses, right? Okay, so we're going to be doing a little bit of strength testing. So firstly, I want you to push your toes against my hands here. Okay, I'm going to try to pull on them. Don't let me, right? Okay, I'm going to push against your feet. Don't let me. Okay, very good. Alright, so now I'm going to work on your legs. So I'm just going to be grabbing one leg and just pushing it so that it's up, right? And then I'm just going to be moving that down to the side, okay? Laying that down. Any pain or discomfort? Okay, I'm going to pull that back and lay it back down. The other, and just pull, okay, and lay it out. Any pain or discomfort? Very good. Okay, I'm going to let that go back. Now I want you to move your leg straight out to the side, okay? So like if it was my arm, then you would go straight out, okay? Very good. Okay, can you do a small coordination exercise for me? I want you to take your right heel and I want you to touch your left ankle. Good, and I want you to run your heel up to your knee, your left knee along your shin. Yep, just smooth like that. lift up, go back to your ankle, just slide back to your knee, okay? Do that a couple times for me. And now can you switch legs? So you're using your left heel along your right leg, right shin. Okay, very good. So now real quick, I want to check a reflex in your foot. I'm just going to be running the side of my reflex hammer along your foot, okay? Alright, so I'm just going to firmly, okay, the other foot. Very good. Alright. So I'm going to have you sit back up for me. Right, very good. So now I am going to push down on your thighs, on the top of your thighs by your knees. I want you to push back up, okay? Okay, very good. Now can you lay your hands on your thighs just like this, right? And then I want you to flip them over and then back, over, back, and do that as fast as you can, kind of like just back and forth and back and forth. Back and forth and back and forth. Okay. Alright. Can you hold your hands up like this for me? And I want you to touch each fingertip to each thumb. Back and forth and back and forth and back and forth. Okay. Very good. Excellent. So now we're going to do a coordination test that involves you rather. I'm going to just hold my finger out. I want you to touch your nose and then touch my finger so it'll look like this, okay? Alright, can you do that for me? Okay, very good. Just back and forth and back and forth and back and forth. Okay, now I'm going to be moving my finger around. I want you to still touch my fingertip. Just kind of chase it a bit. Okay, nose, finger, nose, finger, nose, finger, nose, finger, finger. Okay, very good. So excellent on the coordination tests, and then we're going to check some of your reflexes here. Firstly, I'm going to test your bicep, and I'm just going to have you relax your arm down. I'm going to put my thumb right at the crook of your elbow here, okay? Good. Other side. Just relax your arm. Good. Good. Okay. And now I'm just going to have you lift your arm up and kind of put it like this, and I'll hold onto your arm. Okay, and we're going to be just testing the reflex of your bicep, or tricep rather. Good. Put that arm down and let's go to the other side here. Very good. Okay, let's go ahead and check your knee-jerk reflex real quick. Good. Good. And then I'm just going to check your Achilles tendon reflex. Very good. So, lastly, we are getting to the very end of our test here. I'm going to do one last little test for coordination, and then we'll get to the balance portion. Now I'm going to move your toe either up or down. This position is up, okay? This position is down. And I just want you to tell me where your toe is at, whether it's up or down. Okay? Close your eyes for me. Right. Where is it at now? Up, down, up, down. On the other side here. Down, up, down, up. Very good. So I'm going to have you stand up for me, right? And I want you to walk to that wall over there on your toes firstly. Okay, on your tiptoes. And then if you could walk back for me on your heels. Very good. And if you could walk back heel to toe, so that your toes meet your heel, and then you just keep walking like that. Okay, and you can walk back normally. I want you to just stand right in front of me here and just have your feet together. Okay, now I'm going to have you close your eyes. I'm going to try to sway you back and forth. I want you to not let me, okay? Won't let you fall. Just don't let me sway you back and forth. Okay, very good. You can go ahead and open your eyes. So now I'm going to have you just stand with your arms in front of you. Okay? Close your eyes. I'm going to try to push down on your arms. I want you to not let me. Okay? Okay, very good. Go ahead and open your eyes. Alrighty. I think that's about it. All I've got to do is just make our last notes regarding our balance testing, and that's it. Okay. Do you have any questions for me? Comments, concerns? All right. Well, that was an excellent, comprehensive physical exam. You did absolutely perfect. I have absolutely no worries, no qualms about your results today. Okay? Is there anything else I can do for you? Wonderful. Well, then that concludes our visit. Thank you so much for coming into the clinic today. I really appreciate it. Thank you. I hope you have a whale of a day and a good rest of your night. Okay. Goodbye now.